Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy. And as otolaryngologists, one of the most common surgeries that we do is a septoplasty. Usually a septoplasty is also accompanied by something called a turbinate resection or a turbinate reduction surgery. So the septum is the center divider in the nose that separates the right and the left half of the nose. And these are often crooked in people. Usually in early adolescence we see septums go from being straight to being somewhat crooked. Sometimes that's related to trauma, but it may also be just the growth centers in the nose cause overgrowth of that septum and then has to fold to fit into the position inside the nasal passages. When that septal deviation occurs, it affects nasal breathing. And so people that feel constantly congested or stuffy in their nose, a septoplasty is often very helpful for that. Sometimes a turbinate reduction alone without a septoplasty can achieve the same results and improve people's nasal breathing. When people have chronic nasal stuffiness or congestion, the first thing we usually try is a nasal steroid spray. Sometimes that'll allow adequate breathing and make surgery not necessary. When the nasal steroid sprays aren't helpful, sometimes oral decongestants can help temporarily, but that's really not a good long-term solution since most of those have significant amount of side effects. If people require a septoplasty, the surgery usually takes about an hour. There's a small incision in the left side of the nostril. We lift the skin off the bone and cartilage that makes up the septum and expose that structure. Then we remove the deviated portions and reposition the portions that aren't removed. We lay the flaps of mucosa or the skin of the inside of the nose back down, put some stitches to hold that in place. And then there's a lot of different techniques we use to reduce the turbinates. Turbinates are these side structures that come from the outside wall of the nose and block up some of the breathing along the bottom of the nasal passage. So it's usually best to remove those or trim those at the time we do a septoplasty. So sometimes those are resected and cauterized, sometimes they're just cauterized alone, so it just depends. Different physicians have different approaches to that. After septoplasty surgery, most people will place splints in the nose. So you have these things called Doyle splints, little plastic things that are in the nasal passages. You can breathe through the splints. They have kind of straw holes down the side that you can breathe through, but your breathing's not going to be great until the splints come out. Usually that's about 4 to 5 to 7 days of splint placement before they come out here in the office. Taking the splints out is not that big of a deal. It takes just a couple minutes, and it's a quick thing with minimal pain, and then you're done. You breathe great typically after that's completed. People do typically have some bloody drainage from their nose for about the first several days afterwards, maybe even more. You can have bleeding even much later than that, but that's typically not what we see. So septoplasty takes about an hour. It's an outpatient procedure. Most people miss about a week to 2 weeks of work with that. Odds of improving nasal breathing are above 80, probably around 90 or better %. So if it's something that you've suffered with, certainly talk to somebody about it. We hear a lot of people that are just so reluctant to undergo a septoplasty. They've heard bad things. Back in the old days, they used to put a bunch of gauze and pack the nose full, and everybody has heard of that and really just tries to avoid it when it's not. Obviously, any surgery is something you shouldn't go into unless you really need it, but it's something that generally does very well. Most people are very pleased with the outcomes of that operation. So we're happy to help if you're interested in those things here at Lexington ENT and Allergy, and please let us know. Thank you.